our feet are really important and we want to look after them. And one of the things we can do is to wear good footwear. A lot of the time for safety we would be recommended to wear the sort of shoes I'm currently wearing today, which are lace-ups with nice arch support, good tread, etc. I guess the one thing about lace-ups is it is more effortful to put them on and off than something we can just slip on. And of course we will make choices depending on that, whether we can or cannot do up and undo shoelaces, whether we perhaps use elastic shoelaces, whether we use shoes with Velcro, whether we use shoes that we can simply slip on. One of the things that might be helpful in life is something like a long-handled shoe horn. This is a fairly long one, but you can even get longer ones from IKEA. They're the place with the longest ones I've seen. And sometimes just using a shoe horn to ease our foot into a shoe could be the very thing we need. When it comes to shoes like the ones I'm wearing at the moment, I guess for me, I would tend to bring my foot up because I would say for a lot of people it's bending down that is the issue. Now of course you can see in this position I've got a very bent hip and a very bent knee. That won't work for everyone. For some people they'd be better off with a little footstool that allowed them to have their foot in that position and then they would be bending down. It really depends on you and your abilities, how you are on the day. For me personally, I think for a lot of the people I work with, for a lot of my patients and group participants, this would probably be the position that they'd use. I would, for me, myself, I would keep my back fairly straight. I would undo the shoelace like so. I would then loosen, obviously, the shoelace. And then having done that, take the shoe off. Now, again, it would just depend if that was safe and worked for me. Now, a lot of people would perhaps have difficulty with their socks, even if they had a shoe that was really quite easy to take on and off using a shoe horn. For a lot of us, socks are even harder because we've got to get, the sock right over our toes, which are, of course, the furthest thing away from us. To get the sock off, it might work to use something like a shoe horn, slide it down behind the heel, use the floor as well, get the sock off like that, and then maybe use a reaching aid, like one of the reaches we looked at earlier, or use the hook end of the device and just hook it up, maybe even using my foot to get it up, or maybe I'm fine to bend down that far. To put the sock on, if you struggle to get down, then probably using a device like this one, the sock aid, is the way to go. Now again, it does require hand dexterity. It means that I've got to compress the 3 fingers of the sock aid to that extent so that I can get my sock onto it. I would tend to hold it against my body. I would use those parts of my thumb to do a lot of the pressing. I would get that sock on. This is what's required to use this particular device. You have to get the projections of the sock aid all the way to the toe bit of the sock and then bring the top of the sock up to about 2 centimetres away from the top, or 1 inch away from the top, depending if you operate in metric or imperial. You've got the heel at the back, and then you're going to hold the tapes and lower the sock aid down to the ground. You're going to put your foot in, and then you're going to pull firmly, and the sock will travel up, just like that. And then you pull the thing out at the back, and voila, you've got your sock on. Maybe you just drag it slightly on the carpet just to get that heel in a comfortable position. But that is a really useful way for a lot of people. Obviously, it doesn't work for every single person's issues, but for a lot of people, particularly people who've had recent spinal or hip surgery or knee surgery, they are still in the early stages finding it difficult to get right down to their feet, or they may well have been told by their surgeon, don't bend down that far for at least 6 weeks. If it's cold, you're going to want to have your socks on. Maybe it's okay for you to ask someone else to put your socks on, but maybe it isn't. Maybe you really want to do that for yourself. A device like this can help you do that. So Tom, you would generally use some sort of footstool for your, on the side there, which your knee isn't so flexible, similar to something like this arrangement.
Yes, Michelle.
Both to take your footwear off and
Yeah.
to put it back on again.
Yeah. So I just plonk it on there and I can reach my laces. It's not putting a lot of pressure on my knee joint. And then I can just slip my shoe off.
Great. And then same thing in reverse for doing
Yeah.
it up. Yeah.
Yep, so I just plonk it in. I can secure the laces quite easily.
Ooh. Thank you. So for some people, doing up laces would be, something that they would find difficult or couldn't do. So they might use a similar arrangement to Tom's arrangement of a small step stool or footstool, but they might use Velcro shoes, or as I said earlier, they might use elastic laces. What I've found where people have needed to use elastic laces is often that a device like the reaching aid can be helpful just to hold the tongue of the shoe and also hold a shoehorn, just making sure that the laces are in the right position, the shoe itself is in the right position, and then sliding the footwear on. And with elastic laces, that will generally tend to be in a comfortable position. You might just need to use the reacher to pull up the tongue of the shoe. Sometimes I've found that in that situation the tongue of the shoe is hard to pull up and this can slip a bit. One way of making this a bit more grippy is actually to wind some elastic bands around each bit of the reacher, not necessarily just for pulling up tongues of shoes, but for lots of different things. If this isn't just giving you enough grip, then elastic bands can really enhance the grip. So Deborah, you've got a slightly different plan of action with your shoes.
Yes,
Would you
Michelle.
like to tell us about it?
I like Velcro shoes, and in fact sandals, I almost always use Velcro. But with my shoes, when I buy a pair, I tie them up and then I just pull out like that.
Yeah.
And then I just pull back in again, and I might have to do a tug here,
Yes.
but basically that's it, and I don't do any laces at all.
Okay.
I don't have any shoes where I do laces.
So you just have those laces to the point where you feel, yes, this is comfortable,
Yeah,
and you don't find that your shoes are too loose on you.
no.
And it's probably that style of shoe
Yeah.
and your particular foot.
And
that are
also
a good
having
fit.
short laces. I know
Short
it sounds
laces.
silly, but
No.
having short laces, you're not worrying about long laces undoing or anything and then
Yes.
tripping. So
Yes.
I sort of, that's what I try to do.
And what's your brand of shoe?
This is this is an extra wide shoe. I think it's for Sony.
They look lovely.
Yeah, thank you. Yeah, they're very comfortable.
Thank you.